River with a large catchment area of over 200,000 rural lives on both sides of the Mississippi River. In regards to Wonca, I'm running with the vision. Am I too? Oh, it was asking me to answer something. I'm running with the vision of Wonca becoming a major contributor of equity and justice in health. And within the health equity agenda, we must address disparities in rural education and rural health. As one area. The other one is, number two is advocacy for public, economic, private, and health system support of family doctors doing their work so that we achieve fair pay, appropriate and safe working and living conditions in urban, suburban, rural, and remote locations. That family doctors and their healthcare teams are protected from harm and armed with appropriate preventive and safety measures, and that we watch and help each other throughout all regions in the world for equitable access to vaccines and personal protective equipment, especially during this time in the pandemic where we had seen such tremendous inequities in regards to access to this. And then a focus on organizational equity, structure and budget issues within Wonca. We do need to look inwardly into our own organizational equity and develop strategies to address economic, gender, language, geographic, broadband, and pandemic inequities that are affecting Wonca, starting with the creation of an organizational equity committee in each region. The organizational equity committee that I have led it for the last 3 years was initially thought in regards to gender equity, but we have to look at all of the other inequities that we're seeing within Wonca. In this year in particular is noticeable. The pandemic has, I think, showed up a lot more how economic inequities are affecting our world. And then regarding the rural Wonca agenda, my priority will be to meet with you, with the working party in rural practice, and listen to your thoughts and your wisdom, and seek your advice for proposals on large scale. I had a conversation with, I don't know how much longer to go, but I think that our conversation that I typed Bruce a few weekends ago, we have countries that are signing on to a declaration on Astana calling for primary health care for all. And to me, that means equity and justice, and that all people have the potential to achieve good health. And we have a lot of allies supporting primary health care, the WHO, UNICEF, even the World Bank. But at the same time, I don't see a true commitment of members of the UN, of our state governments and countries that are really investing in primary healthcare in the way they should do, and there's definitely not an investment in rural healthcare to the level that it should be. And so we need to continue to work on that advocacy and standing with Wonca in a stronger position to to collaborate with countries and governments and policymakers, public and private sector, to really, really say, okay, this is your promise. Where is the funding for the work of universal health coverage? Where is the, what are we doing to really improve the number of people going into primary health care from medical schools, and in particular to rural? What are we doing to recruit people coming from rural spaces into medicine so that they are more likely to return to rural? So I'm going to stop right now so that I don't take more than 5 minutes at this point, but I'm happy to answer any questions.
Yeah, look, I think you've raised some really important points about rural practice and family practice being at the front line and being able to see what's actually happening. I think the safety issues are a really big one that I hear all the time from particularly those in lower middle income areas. The whole safety of them and their family, and in fact their patients too. So really good points, Viv, and thanks for that. I might go to Raman now as another presidential candidate, and Raman, if you'd like to give us your views on those sort of things. And I'll open it up for questions when we've got around the group. So Raman.
Stupid.
Unmute first, Ramon.
Oh, thank you, Jakur. Thank you, Bruce, and all Rural Cafe, Wonca Rural, for us to for giving us an opportunity to present our viewpoints, share, and chat with you whatever thinking about rural Wonca Rural in general. And we know each other from our work, and largely in my thinking, we should look at how our world is like. What our world is like in that sense, what is our total population, where this population is located, what are the countries which are predominantly rural, which are the regions of the world and Wonca which are predominantly rural, what is the strength of Wonca, what is the volume of Wonca, how much Wonca has reached and evolved till now. And if you look at the history of Wonca past 50 years, we see that it evolved from, we did have participation from many countries of the world. A bit of how Wonca evolved. It was founded in Australia, 1972, and there were few meetings. One of the first ones, third one probably, just before Australia was held in India also. But largely, if you look at the participation of family doctors, it's predominantly, the countries where family medicine is already good. And now we see the regions catching up, like Africa, Latin America, South Asia, Eastern European countries, even Middle East. These are the regions which are catching up with the, what already was achieved in the developed world half a century back. So, it is not just family medicine perspective, but also, the economic disparities, economic differences of the countries, and within health systems, how things have been placed. Largely, the way I see is the primary care, public health, the way it has been understood, especially for the low middle income countries where the majority of the population, rural population lives, has been catered through during past 50 or 70 years on vertical disease-based programs and not comprehensive generalist care. And this is one of the challenges for us as Wonca to be able to reach. And even if you look at the global organizations, whether it WHO or World Economic Forum or other organizations, still, there is reluctance, though we talk about universal health coverage, the reluctance to call for a complete, implementation of true universal health coverage that we understand in terms of the developed countries. Even the parts of the world where we are now talking about universal health coverage, that is still, very different from what it should be. Finances many times are being proposed only for the hospitalizations, which are predominantly yet, located in the urban locations. The way the universal health coverage finances are organized, it is not covering, the primary care services, the family doctor services, and there's a gap in what should be ideally done and what it is being proposed at the moment. And if you look, it is a dichotomy that while we are talking about universal health coverage, there is continuous push for the fragmented vertical care programs. Nobody is calling to stop them, this I find very politically strange at the global level, especially in the health sector. And these are the challenges we face in our day-to-day advocacy work or leadership work or organizational work that we do in our parts of the world. And when we approach, there is a structural barrier to what we are we think is right, because there are systems in place for past 70 years, 50 years, half a century, which are barriers, to call to do away with all vertical programs, to establish comprehensive generalist care, and to be supported by primary care through family doctor centered teams, is a really very, very big trajectory, and it's more challenging than what we normally I see, imagine within the Wonca discussions, and mostly we are very superficial in that terms in our discourses, and in the depth of the problem is much deeper or more difficult than we even imagine in many parts of the world because of the political reasons, the organizational structures of the governments, the way policies have evolved. And to challenge that status quo is it's not that easy. So having understanding of first acknowledging that gap is very, very important for any leadership position. If I talk in terms of Wonca's leadership, so having that perspective is very, very important. How and then to engage politically, because ultimately Wonca president's position is political in terms of engaging with various stakeholders globally, whether we talk about governments or global health agencies or global development agencies. We have to make right political moves so that we do not see ourselves as antagonistic of what is happening, but we contribute to a flow of decisions or pipelines which evolve, which may lead to our desired kind of outcomes that we desire. So this is what I feel from our level, and Wonca needs to expand. It needs to become bigger. We call Wonca a global organization, but Wonca has to get strong roots, at least in the 70% of the countries of the world. We are strong in many places. Maybe out of 200 countries, we are very good, or at least the family doctor system is good in maybe 40 countries. But there are 160 countries where we are not present, not well evolved, infantile, and we need to focus on those countries. And by saying those countries, I mean communities as well as the population coverage. So when we say universal health coverage, we must say Wonca for universal health coverage in that population terms also. So to be able to reach out to those population, those countries, those unmet needs of the global scenario, we need to have a right anchoring of leadership, a right balance of leadership. And we have had leaders from developed parts of the world, Australia, United States. Traditionally, all presidents have been from Europe, Australia, and United States. And it's challenging still, because in spite of having a quarter of population from South Asia, it is very difficult for any leader to emerge, because unless the whole world supports, it cannot happen. So everybody has to support for somebody coming from South Asia. It cannot be based on the regional support. It cannot be based on linguistic support. It cannot be based on a particular section of the family doctor support. So this is my initial thoughts, which I would like to share with you, and then I would be happy to answer more.
Go on mute. Sorry. Thanks for that, and certainly you've put your money where your mouth is. I did distribute the other day the work you've done in India and up to the conference and following the conference. So thanks so much for your dedication there in difficult circumstances. We might move on to Sanka now, who's telling us what the future's all about, because he's going to be he hopes the young doctors representative on the executive. So we certainly do wish him the best. Just so everyone knows, we are streaming this on YouTube, so we will also have a recording of it on YouTube as well. I think I might have missed just the very first couple of words of your comments, Viv. Sorry about that, but we got the vast majority of it. So over to you, Sanka.
Right. Thank you very much, Bruce, for those kind words, and thank you for giving this opportunity. Even though we are not strangers to the working party, I think we have to have a discussion like this. To everybody to know, I'm Sankar Andani Kumar. Sri Lankan family physician, a young doctor, and also the chair of SPICE, Young Doctors Movement of South Asia, Young Doctors Movement of South Asia. And also I'm a council member of the rural Wonca, as well as the Wonca environment. So my start in Wonca was in 2016 at the Rio conference at Brazil, and I joined the rural Wonca as well as the Wonca environment. But some time back we had a South Asian regional conference where actually made me to be a Wonca fan, and that was actually the real initiation of my career in Wonca. If I tell something about my inspirations and why I'm really fond of rural practice, my roots are also deeply into rural areas. My grandfather is rural area, and my father is from an area, even though we were brought up in a semi-urban area. And then because of that, always that the village, feeling of rural areas, the feeling of countryside, that was always in my heart. That was always there. But the real me coming to rural medicine practice was in 2014, where for the first time I was posted as a post-intern doctor to a rural hospital, primary care hospital in southern Sri Lanka, south of Sri Lanka, and that was a small hospital with four or five staff members, and I was the only MBBS qualified doctor there. There was someone called a registered medical officer who are not that qualified. They are sort of, the advanced level, and they were recruited due to less work areas. So I was the only qualified doctor there. And then I felt how rural people has their own needs and what are the real rural setup is like. So that was my inspiration, and that was real point where I entered into rural practice. And I was able to sort of transform that hospital to a model hospital within a few years with the help of our staff members, and everybody, the villagers were support. It was a pleasure that the World Bank recognized my as a model primary care hospital in Sri Lanka. So with that, actually, I was appointed or selected to represent the a committee, an expert committee, which was formulating performance at rural practice. So then, this is actually my rural. Bruce, can you hear me? Because I'm seeing my internet connection is a bit unstable.
Sorry, it did break up a little bit there, but we've heard the rest of it. It was just that small bit there. That. So what are your aspirations, Sankar, for young doctors? Because obviously you've been inspired to be a family doctor. You've been inspired to make a big difference in a hospital or a clinic, or both, in an area. What message do you want to bring to the young doctors?
Yes, Bruce, the motto of my whole camp, avoid future of family medicine around the world. I have assumed young doctors are future of family medicine. most of you will agree with me. And my main objectives for next 2 years would be mainly playing an active role in Wonca by being of young doctors around the globe, which means all the representative of them. I will not be one person, but I will be always representing the needs of young doctors around the globe, and I will work always in the executive. And also, one of my main targets is collaborating with International Federation of Medical Student Associations and also the regional young doctor movement toward family medicine. And you know, family medicine has become main specialty in some of the countries, but still some of the countries in the world, do not recognize specialty, and some sort of bashing as well, even in the medical school level. So I think we have somehow in collaborating the student unions, student associations, and doctors movements, make family medicine career choices. It should be a choice, and they should always go for that, opt for that by their choice, not by chance. And one of the main things, this was actually this point, this objective has established my mind because of our work in the Working Party on Rural Practice regarding rural pathways with the WHO. If you can remember about rural pathways to train and recruit the rural force. So with keeping that in my mind, I have another objective. One of the objectives for that is supporting the training, recruitment, and professional development of young family doctors, especially in rural areas and in the countries where the discipline is underdeveloped. Because I don't think when a family doctor, there's something called developed countries family doctor or underdeveloped countries family doctor. Young family doctors are so anyway underprivileged. They are in the initial phase of their pathway, so they are financially not stable. So because of that, they are financially and with and other aspects they are underprivileged. So wherever it is, even in or underdeveloped country, even in developed countries, rural areas, the young doctor would face several difficulties not faced by the young doctors. So that is one of the objectives. So I'll be supporting with the other the support of the all movements, training, recruitment, and professional development of the young family doctors, especially in rural areas. And finally, I have also thought of collaborations with the working party, because I have worked with the Working Party of Rural Practice and the Working Party on the environment and also mental health. So it's offer a lot of opportunities to young doctors. Now we know the rural Working Party work, and even the other, they offer several research grants, other opportunities, trainings to the young doctors. It's not that much known by the young doctors, and also there has not been much of coordination. So I'll be collaborating with the work party and also special interest groups, SIGs, to support the young doctor engagements. So these are the main objectives and plans of of my candidacy in simple terms to be for the future of family medicine to play an advocacy role in the Wonca executive.
Thanks, Sanka. And you are a very strong and great advocate and a great example for young doctors. So thank you very much. So we've got a little bit of time for chat. I think we'll come to Pratush. And Pratush, if you'd like to tell us a bit about, Pratush is obviously the Secretary of Rural Wonca and also been a member at large on council, and is applying for a second term on that. So Pratush, do you want to talk about what you've done and what you're doing and what you hope to do?
Yeah. So thank you, Bruce, for organizing this special meet, because I feel that we need to discuss more on these issues, that why everyone should vote a young doctor, why anyone should vote anyone. And this is very important to know, to take a very informed decision. And for me, a basic background that I come from a village in Bihar, and from where I was born and brought up. And that was my biggest motivation, because I have seen the difficulties which are faced in rural areas. And that was the most important learning for me, to understand the importance of social determinants of health. And then I got the realization that it's very difficult to treat all the diseases, illness just with medicines, when the root causes are poverty, unemployment, lack of nutrition, water, and sanitation. And this all in the background, I made an informed decision to took family medicine. My rank was around 1,725, and at that rank, people usually take pediatrics, surgery, ENT. These these are the branches they take. But I took it by choice, and it surprised many. Even the counselor asked me that you should think twice before taking family medicine. But I took family medicine, and I was awarded the best DNB family medicine doctor, which is first for any young family doctor to be awarded by a college. And then gradually, when I was in residency, I came into contact with the AFPI. Dr. Rampa organized the AFPI National Family Medicine Conference. I'm very lucky to meet Dr. John. And he just introduced me that we would like to have rules, South Asia group should be there. At that time, there wasn't any group. So during my final years of residency, we launched Wonca Rule South Asia. I went to Colombo, and Dr. John and Dr. Raman were very instrumental in getting these things organized. I will be always grateful to them for encouraging and promoting young doctors at that very young stage, because I feel that this is the best investment you can make. If you're investing in young doctors, you'll gain in the long term, it will be rewarding for everyone. And those investment finally led to this Wonca World Conference in Delhi, and we managed to do so many another World Conference in Bangladesh. And then we did on some very interesting projects, like we did some rural health success stories with rural seeds with Myra and her amazing team workers. Then I started a different project called Happy G, which was health advice and promotion, disease prevention among youth to geriatrics. It's an online and offline project. Offline, we do within community care projects. And during COVID, we did something. We also did online video series, like in COVID awareness, we did some 20 different videos. That also within some different languages, some 15 different languages with all the rural Wonca colleagues. It was the collaborative effort. And then we did similar kind of activities on suicide prevention. Plus, we also did on air health. Planetary health is very important. And we did a webinar on planetary health. And we also took part in some statements, which is going to get released soon. Then the most important thing for us was equity is very important, because what I feel that young doctors and those from lower middle income countries, those from rural areas are not properly represented. So to get more representation within our Versa setup, we made many leaders. We helped amplify their voices at a global stage. And that was very important. As a young doctor, I'm more committed to promote many young doctors to take the global stage. And it's very important because as we create more leaders, they inspire many more young doctors, many more normal persons to take up this job. And that's how we add values to this great organization called Wonca and Rural Wonca. And we act as a role model to encourage many young doctors to get training in the rural areas, to get back jobs, and to remain in the rural areas for a long period of time. Because as a model, when I started working in rural areas, there are many doctors who have started working in rural areas. Our learnings from our mistakes, we act as a model for many doctors to guide that yes, there is a way that you can happily live in rural areas without much difficulties. And these are experiences can only motivate future doctors, because I believe that obviously there will be change, the change in policies, the change in government decisions, but there is bureaucracy which takes its own time. What's in our hand is to take individual efforts and also collective efforts through such organizations like Rural Wonca and Wonca Global to encourage young doctors to come join Rural Wonca. And the next most important thing which I want to focus is that obviously Wonca is an organization of family doctors, and we have to keep our interests intact. But we also need to look beyond family doctors. We need to advocate about family doctors just beyond our organization. Otherwise, our voices should reach a normal people, normal patients, public at large, different communities like nursing community, dentists, other paramedics, other health workers, because they will only act as our ambassadors to promote our views, to support us at global forums. They will be our voices. And our strength is in the content which we produce. If we collaborate more, if we engage with more like-minded organizations, then we'll come out with better content and it will be more accepted globally. And if we involve rural doctors, then the content which we produce will be more acceptable locally also and also globally. That's all from me. Thank you.
Off mute again. So thanks. And I think just the work you've done in Bihar has been amazing, and the work you've done with to demonstrate how you can be such a good family doctor at a local level, but also at a global level is terrific. I'll just open it up for questions or comments along the way. We've got another about 16 or 18 minutes. So John's got his hand raised. So John Wynne Jones, go ahead.
Well, thank you. Thank you, Bruce. And I just really appreciate the passion that you all have for improving things in a clearly inequitable world. And Viviana, it's across the board, this inequity. And I saw there was a recent paper that the National Rural Health Association in the United States drew up that showed that if you lived in rural America and had COVID, you had twice the chance of dying than if you lived in urban America. So, I think we've got to remember that some of these issues are ubiquitous wherever you are in the world, even in the rich countries. Could I just play devil's advocate a little bit with you? This is for everybody. One of Wonca's missions was always that everyone should have access to a family doctor. Now, realistically, we're not going to achieve that. We're not going to achieve universal health coverage by 2030. So I think certainly in the short or medium term, we're not going to manage that. And the Astana Declaration, which you were all involved in, emphasizes the importance of teams. And probably some of the most effective health workers in the world are actually community health workers. And, you know, I look at Asha in India and some of the amazing work that they've been doing. And we've already in rural Wonca begin to try and break down some of these boundaries between other professionals, looking at because we've got nurses on our council, and we've got a nurses group working. Rural Seeds has even gone further than that, and Rural Seeds sees itself as a multi-professional young students and young doctors groups. So really, I just want to ask you how Wonca will embrace and build proper links with other professional groups, and should other professional groups be admitted to Wonca, and perhaps, you know, should Wonca become a multidisciplinary organization?
We'll open that up for everyone, but Viviana's obviously ready to go. So Viviana.
So first of all, completely in agreement with the work with community health workers. That's during this past year, I've been part of the North Carolina Department of Health and Human Services pandemic response team. And one of my roles is to train community health workers. Then at 10 a.m. my time today, I'm going to be working with 300 community health workers that we update on a regular basis on, you know, how to approach the pandemic. At the global stage, Wonca is working very closely with the International Council of Nursing. We are working with the World Public Health Association. We are working with many other organizations. I personally belong to a Department of Family Medicine and Community Health that hosts the number one physician assistant program in the United States. I cannot imagine working in primary healthcare without a strong team, that we alone cannot do this. And so it's been my personal approach has always been that we are better if we have a good team. I learned a lot in my first practice in rural Iowa because I had my nurse Leslie who guided me. You know, any one of us has to have the humility to realize we all learned a lot from our nurses. So that's my on a personal level. I think we are only strong if we talk about primary healthcare teams and work together with organizations instead of fighting with each other, to actually learn from each other and work together. 2 years ago, when the Wonca work, rural Wonca happening in New Mexico, there was a very strong commitment to talking with nurses and bringing nurses into the fold. And I do see this as a moment of tension for Wonca. Some of our large organizations are not recognizing the role of those other members, John, that you share. And I think it has to be a very important conversation to think about how do we go about this together and not as enemies. We can never succeed in primary healthcare without a strong team. The work at WHO has always been part of, you know, understanding the team. I think our message has gone from strictly talking about family doctors. I not just think, I know our message has gone from only talking about family doctors to talking about family healthcare teams, right? Like we have to work together. And we cannot, as family physicians, be in every place. We do have to recognize that it is extremely expensive to train only doctors to address primary healthcare needs, and that we have to work together with our large organizations on training the teams and being part of teams.
Thanks, Viv. Has anyone else got anything they'd like to say on that? I noticed we had one comment in chat about just from Canon Tuz from Turkey, just about looking at how we do have representation on on World Wonca, and that's why we've got the Wonca Working Party, the rural Wonca, Canon, so we can make sure that there's advocacy up. And obviously we're so lucky with the candidates that we've got that they've heard that message and are taking that forward. So would anyone, any of the other candidates like to say something, or anyone else want to ask a question?
Bruce, may I come in?
Yeah, Rowan, go ahead.
Thank you, John, for raising this very important, part of debate that we often have within Wonca and outside, and it's very important that we have clear ideas and views on this for future development of health systems across world. And you're right, rural population, irrespective of their economic levels, are disadvantaged. I completely agree with you. If you remember our Delhi conference, we had a award ceremony when we had our vice president present, and the people who were recognized there were the nurse practitioners, ASHA workers, and it was our effort to not just integrate them, but also to recognize their contribution to the health system, especially in the rural context. And this is very, very important. I completely agree with Viviana that the discussion has now evolved into primary care teams, and we want, of course, family doctors to remain contextual, relevant to this discourse, but definitely we have to accept that this is a teamwork, but simultaneously, in terms of being a organization of multi-professional, when you ask, I think this was not covered and discussed yet, but the overall objective of Wonca, as to advance the professional interests of the family doctors. And in one of the earlier discussions, I said that, are we, selfish to talk about family doctors? But if we look from the system's perspective, especially, there are countries and health systems where there is no adequate structured referral system, and where this is random patients going to any facility, tertiary care, especially those which are privatized and not insured or insurance covered. There we see, unless you have a family doctor in place, or when you build up a new primary care system, if it is devoid of physicians or family doctors, it is a down regulation of the referral system. It is a complete down regulation, and you see more of screening and referral to the higher center, tertiary care center, and that would cost more expenses of money to any publicly funded program. And this should be our concern to address, especially we want to embrace all professionals and into our teamwork, into our work, and we do recognize their contribution, but we cannot down regulate the referral system within the discussion of universal health coverage, and there cannot be a primary care system without any family doctors. There are many places where we are talking about we do not need any doctors for primary care system. It is basic system, and there should be screening and there should be referral to the specialist, and there's no role for any family doctors. So this is not acceptable. Thank you.
Thanks, Raman. I think that's a major issue, isn't it, about the need for family doctors to be able to do the continuity of care and make sure that people have appropriate specialist care, as well as obviously access to the team. I noticed Pratush put something in there, and I noticed Eamon came on. Did you want to make a comment or ask a question, Eamon, and then we'll go on to Pratush?
I just want to ask the presidential candidates about what do they feel what Wonca did best over the years, and what do they feel what Wonca can expand in the current environment and do better? Because it's a huge organization as far as I'm concerned. but I'm not sure about the achievements that we've done over the years, and how can we consolidate some of the work that's been done.
Thanks, Ayman. We've only got a few minutes left, so just 30 seconds from everyone, I think would be good. Thanks. Viv?
So I think advocacy for family medicine, Ayman, is what Wonca has done best. And at the same time, it doesn't have a budget that can support the amount of advocacy that's needed. As a representative of Wonca at the WHO, I often have felt that we need to have a much larger delegation there addressing issues that are germane to family medicine with every department. WHO is a huge organization with many issues that are germane to family doctors. And if we are not involved in every one of those, we lose. I think more advocacy at the country level and each country level, as civil society members saying, wait a second, this is your promise. Where is the funding? Where is the budget? Where is it that we need to do more training on leadership and advocacy on how to speak to everyone that has to make a decision, including medical schools with a hidden curriculum that favors narrow focus training over general practice training, right? So there's a lot where we can do better, but I think so far we have done advocacy for family medicine and putting us together. And that's an important task, although we need a bigger budget to support the work we need to do. And I don't want to take away the time for others.
Thanks. Raman?
Recently, we have been discussing about the changes that we have brought in India, integration of the rural generalist component into the national curriculum. And this happened because of Wonca's rural conference in Delhi. So this is, I can say, definitely is one of the achievements in, making policy change in a country of billions. Minor shift in policy can lead to benefits for, millions and billions of people. So this is one of the things, but I think we can do more. This is, one of the special, or I can say, successes, but we need to do more of its implementation throughout world, similar kind of activities through Wonca. And we have produced resources for academics, but I think the volume of that resource should be more, and that can be possible only we have, large number of family doctors from rural context, rural experiences participate, contribute, and for that we need to have a bigger network. We have to expand ourselves.
Thanks, and you've done that beautifully in India too. Thank you very much, Sankar.
Rubbish.
Yeah, thanks. I think the Wonca has done certain things to highlight the rural practice and the importance of rural practice in universal health coverage, especially with WHO. But I think we have a more sort of advocacy role to play, definitely. So as a young doctor, I would say, as a person who knows and who has inspirations on rural practice, I would play an advocacy role to the executive, and through that, an advocacy role which would be a broader one to the world organizations for importance of to highlight the importance of rural practice in universal health coverage, because in most of the countries, the majority of population is in rural areas. And also, I think the conferences can make a huge difference. I'm telling this with first-hand experience about India, where the rural health conference we had in India in 2017 made a huge difference in policies, because the political commitment was initiated with the conference. I think that Wonca can always contribute and support the regions to have conferences with the support of the political leadership as well, where these highlights the conferences and the policies, the policy decisions and declarations that are made at the conferences would lead to policy changes in those countries. So that's it.
Thanks, Sankar. And Pratish, you get the last word before we have to head off to council. So as far as the candidates go, and then I'll just do a quick quick wrap.
Thank you. Like I was going through so many questions, and it's very important, the questions by Marjorie and others. In brief, what I would like to say now that rural is a cross-cutting subject, and it has got bearing on other specialities also. Wonca has immense power in its working parties and special interest groups. And just like Wonca Rural had its own conferences, other working parties and special interest groups will also start their own conferences, own seminars, and also starts to engage more family doctors, becomes more active and vibrant, then we will be able to advocate about family medicine, the ethos, the principles of family medicine much more widely, and will have much more coverage. And plus it will help Wonca also to grow much bigger, and it will also help the family doctors who are working at the grassroots levels to get recognized, to come out of the isolation. They will feel their works being recognized, their works being promoted. So it will be a win-win situation for both. Wonca will get bigger, and family doctors will feel a place they can call it their own. Thank you.
Thanks, Pratish. And I think those aspirations for our future doctors are shared so much by the members of our Rural Wonka Council, and particularly with so many young members now. It's wonderful. So thanks very much to the candidates. We do have to pop off now to our Wonka Council. So just so much gratitude to very busy and important people who've been able to join us tonight. And we have, as I said, been streaming this on YouTube, and we'll put it on our website so that everyone can have a look at it, and we'll go from there. So my computer's telling me right now is Rural Wonka Council, so we'll head off, and those of us who are on council will meet you again in a moment or two. Thank you very much, all. Bye-bye.
Thank you all. Thank you very much.
Yeah, thanks, Viv.
Bye-bye.
Thank you.
Bye.
Thank you.
Thanks,
Bye.
Wonka. Thanks, Pratish.